Welcome everyone. Welcome to the Bridge Builders of Diversity.
Hello.
Here we are.
Today we're going to talk about traumatic brain injury.
I know, not a very happy topic, but we've got some good information for you, just in case this is something that you might be dealing with in your life.
And there can be many different causes of traumatic brain injury, right, Kim?
Right. So what is it? What is a traumatic brain injury? It's a blow to the head. That's by definition. Blow to the head.
Concussion.
Concussion. Well, that's one level of TBI.
A thunk on the noggin.
Yeah, it can be penetrative as well, like a gunshot wound.
Yep. Or like our military men and
right.
women.
A lot of them come back with TBIs.
Yes. Yeah.
Need a lot of support. So, like I said, there are different levels of TBI. The concussion being the mildest form of it, and you see a lot of that with children. School children involved in sporting activities, they may have, a head injury, crashing into another player, having the ball, baseball player hit, missing the ball, got blow to the head.
That's
football,
why they have all those concussion
helmets.
protocols
Right.
today for schools.
There are,
sports,
and there's certain things that they have to go by, and there's a whole
there's a whole protocol
for it.
We're realizing how serious a
It can be
concussion can be
right.
now.
Yeah.
Especially if you've had multiple, and a lot of these pro ball players, football players and whatnot,
Especially
end up
football.
debilitated, quite debilitated.
Absolutely. No.
I'm sorry.
What's the name of that? There's 3 letters that. It's an
you're talking
acronym
about,
for what happens to the
Right,
ball player's brain after
I'm losing
repetitive.
that
Yeah, if you have any
definition.
chance to research the football players and all the research that's been done on their brain injuries
There
and
was some
stuff.
litigation actually.
Yeah.
There
was.
And it's such tragic stories,
Right.
really.
Yeah, they really.
But anyways.
So
I'm sorry.
anybody can get a
Right,
traumatic
so wear
brain
your helmet.
Right, and there
Wear
are
your
different-
helmet,
Wear
wear
your
your
helmet.
seatbelts.
Right. There are different levels. The more severe, obviously, more severe cases are those who have been in a car wreck that's injured their brain, or they've had gunshot wounds, assaults with weapons, falls, elderly patients who have fallen and hit their heads. Many times they succumb to that. You pass away from those types of injuries. Those are the most lethal. But those who do survive those type of injuries have different levels of care that's needed. They're going to definitely need a lot of support, rehab. Sometimes there's surgical interventions, of course, if there's a gunshot wound or, skull reconstructions, etc. Social services needs to get involved in things like that right from the hospital, and then they're placed. Many people go to rehab centers to help them perhaps learn to walk again or talk again, or learn to live without sight. Things like that.
I actually saw a cute little story on Facebook. I don't remember the young lady's name, but she was like in middle school, high school, and her brother had a traumatic brain injury, and she was determined to find an activity that her and her brother could do together, and she joined the cross-country team, and she had her brother in the stroller, and she ran with her brother, and her parents were like, we don't expect you to do this, and it just was not an option for her.
Right. Absolutely.
And I've seen other stories like that too with siblings who really
I
want to be
actually
able
knew
to.
a pair of siblings that did that. It was, I know we're off traumatic brain injury, but the same exact thing. His brother was confined to a wheelchair because he had cerebral palsy, and the brother was playing baseball, but the brother with cerebral palsy loved baseball, used to go to every game, so they let him join the team and have an at-bat, and he would push his brother around.
That's
the
cool.
bases.
Yeah, that's cool.
Very cool.
And one thing, according to the Mayo Clinic,
Back
that
on
I
track.
thought was interesting for risk factors is newborns to 4-year-olds, young adults 15 to 24, adults 60 and older, which makes sense, and males of any age.
Are more prone to traumatic brain injury.
Yes.
Right.
Yeah.
Men, be careful with your head.
Kimmy might be able to verify that, right? Young men.
I work in an ER, so I see a lot of traumatic stuff. Men mostly have the gunshot wounds. The elderly have the falls.
Yeah.
Right.
And kiddos, a lot of concussions. We see a lot of concussions. rare is it that I see a traumatic brain in my area. I work at a local community hospital, but I see most of that. It's young adults who, and
Well, you're
Maybe.
young,
With your
you think
head.
you're invincible, you know?
yeah, you do crazy
Right.
things.
And
Yeah.
what are some of the things that can happen after you you survived a traumatic brain injury? What are you looking at?
You feel very sick afterwards.
I'm
No,
sure.
I mean, there are-
nauseous,
Oh,
blurry vision.
that's
So you're talking about a
you're talking about
concussion.
concussion.
Yep.
So concussion, you're right. They will give precautions, and they'll tell a parent, listen, you need to watch for excessive vomiting. If the kiddo is confused at all of a sudden they're having very blurred vision or their
Right.
speech is off. Those are just get the kiddo right to your local emergency room.
Yeah.
And it's about rest post-concussion. Rest.
Yeah.
Limit screen time. That's big because the kids,
Oh,
they're
too
not
much
doing
light in
anything.
your eyes?
Yeah, you don't want to
Yeah.
let stimulation.
Yeah, when I
It's
had
too
my
much
concussion,
neurostimulation.
I just wanted to lay in the dark
Right.
room,
Dark
no
room.
noise, no light.
Headache is part of
Yeah.
it.
So no input at all.
No,
It-
just
because it
rest.
just stimulate your brain.
Right.
And you don't want that. You want your brain to rest.
Right.
You're right,
That makes
because you
sense.
need your brain to heal.
Right.
Yeah.
But as far as the traumatic TBI,
Yeah.
that is, there's usually surgery, and then there is after surgery that there's recovery, usually a rehab unit of some sort,
Mhm.
and it really depends on what's been injured in the brain.
Right.
What center is the speech gone?
What part? Yeah.
What needs? Can they no longer remember how to walk or think or speak or see? I mean, there's so many. I mean, the brain is a very miraculous,
Yeah.
complex organ. The whole from
And they have specialized rehab centers for that, because I was involved in a case where a young man fell off of a bunk bed and hit his head on the post coming down when he was
That's
sleeping. He had a
blunt force,
traumatic
yeah.
brain injury, and his parents had got him into a rehab hospital. I don't remember where it is, but I know in the United States.
It was specific for brain injuries.
Yes, yeah, for
I know.
traumatic brain injury to relearn how to do everything, just kind of like with stroke victims, how they have to relearn.
So are there any indicators that would lead to a more positive outcome or negative outcome?
It's getting them the rehab, honestly, and it's
So that's the most
continuing to use that whatever program the PT does or OT has.
They have
You
to
know, and-
rebuild the neural pathways,
And sometimes
right?
you're going to get what you're going to get, honestly.
Right,
Some
that's
people
exactly what I
it's
was thinking about
long-term.
with Alzheimer's.
Right.
Remember our talk about Alzheimer's,
Right.
and that and Alzheimer's will tangle up the neural pathways. So when you have a TBI, that's the same
It's
thing.
similar, in fact.
Closed off a neural pathway, you just
Yeah.
have to build that
Right.
path around.
And I
Your
believe
brain
it's the
is
same in
miraculous.
stroke
It
as
is.
well.
So one more
rebuilding.
time for the cameras: be careful with your hand.
Yes, use
as
your
best
noggin.
you can.
That's one thing I've always told my son, because my son plays hockey,
Yeah,
which
it's
is a very contact sport.
high rate of concussion in hockey.
Yes, and I've
Lots
always
of
told
things.
him, protect your head.
Yeah.
And he's done pretty well. He's only had one little minor.
And a knock wood on that one.
Yeah.
And you just want to touch on TBIs and our soldiers coming back from
Absolutely, because they're
far
the
and
ones-
away. They need a lot of support. There's
They do.
they're not the same when they come home and they've had some type of injury like the
Right.
TBI.
And that might be cumulative too, because I know that a lot of servicemen that I've spoken to, they talk about getting their bell rung. I got my bell rung
Right.
7 or 8 times.
Right.
So now I'm thinking, just like a football player, that cumulative
Right.
Exactly.
effect to their brain
Right.
from being.
There's a lot of things.
And even-
Depression can happen.
Yeah,
A lot of
default.
that related to concussion. You can have depression.
Right,
related to that.
personality.
And even all the
changes.
trauma that they see
Right.
in war
Right.
and in the military and the stuff that they have to do.
It's going to be affecting the
Yeah,
healing
effects of
of their brain.
PTSD. There's
Yeah.
all of that. But there are support groups out there. I do have a couple of let's see, the Brain Injury Association of America, the United States Brain Injury Alliance, and the Military Health System has Traumatic Brain Center of Excellence. So those are things you can look up as well if you have a loved one who needs some support or you need support. It's out there. Try to help you with a couple of spots to look up, but
And one other
So
thing.
that will all be in the comments.
it'll be in the comments. I'll put it
Good.
down there.
And another thing for young children, they may have different symptoms than adults. So changes in eating or nursing. If they're more irritable, you can't console them, the persistent crying. If there's a change in their ability to pay attention, change in their sleep habits, they're having seizures, if they seem sad or depressed, drowsiness, and loss of interest in their toys. You may want to get them checked out if
You may not have seen what happened.
I was just gonna say, little ones fall all the time
Right.
and thump their heads and get right back up.
Right.
So
Right.
that's good to look for those signs of those
Yeah.
changes.
Yeah, that was from the Mayo Clinic. I
Mayo
got
Clinic
those.
is a great source. Yeah,
Yeah.
CDC, Mayo Clinic.
So if you see any of those symptoms in your kid, kids jump around, they jump off couches and
They're
beds,
crazy.
and and they may not even have the verbal skills yet to say, "Hey, I hit my head and
Right.
I'm not feeling too good." So those are some of the symptoms that I thought is important, because kids typically, even in medicine, have very different symptoms than adults for a lot of things. So
And they might have been doing something they weren't supposed to, thumped their head and didn't want to tell.
you're right.
So yes, watch for those signs in case, in case.
All right, everybody.
Thanks, guys.
I'm Sherry.
I'm Kim.
I'm Roberta.
All right.
And we're Bridge Builders of Diversity. Don't forget to like, share, and subscribe. If you want more information on this topic or any other, please feel free to comment, and we would love to look it up for you.
Absolutely.
Thanks, guys. Bye.
Bye.